Hello, and welcome to the Greater Boston Food Bank's third Ted Cutler Lecture. I'm Joanna Travis, Chair of the Board of Directors, and honored to be with all of you this afternoon. We are excited for today's program, which will include an update from our President and CEO, Catherine D'Amato, and a very fascinating keynote address focused on the impact that COVID-19 has had on our cities by Dr. Anita McGahan. First, we want to start with a tribute to a dear friend of the food bank to whose legacy this event is attributed, Ted Cutler. When Ted passed away in 2017, he left behind a legacy of commitment and support that deeply impacted Boston in higher education, the arts, medicine, and of course, food insecurity. He believed you can't teach a hungry child. Ted was inspired to work with Catherine to lead the $35 million capital campaign to build the 117,000 square foot warehouse at 70 South Bay. Since the pandemic, we have been distributing historic volumes of food with over 100 million pounds of healthy food this past year, equaling over 91 million meals. Ted's vision lives on with us and with his alma mater, Emerson College. Now, we will hear from Lee Pelton, the outgoing president of Emerson and soon to be president of the Boston Foundation, with a personal tribute to Ted.
Good afternoon. It's a pleasure to celebrate and honor the visionary Ted Cutler, who was one of Emerson College's most distinguished alumni and one of Boston's most generous philanthropists. Teddy was a proud member of the class of 1951. He received an honorary degree from Emerson in 2007 and was a longtime member of our Board of Trustees, including serving as chair of the board. He was a musician, and along with his beloved wife Joan, they were among Boston's most cherished patrons. Teddy cared deeply about making our city a better place to live, to study, to work, and to come together. He was the visionary behind the creation of Arts Emerson, which revitalized the downtown theater district. And of course, the Cutler Majestic Theater on our campus bears his name in honor of his generosity and his support of the arts. Teddy's reach extended all over the city, including notably his support of the Greater Boston Food Bank. Under his leadership, the Fighting Hunger, Feeding Hope capital campaign raised $35 million. This success made it possible for the Greater Boston Food Bank to purchase land and construct the 117,000 square foot warehouse at 70 South Bay, which has become a beacon for so many. He often referred to the work and mission of the Greater Boston Food Bank as the most important social justice work going on in the city of Boston. Throughout his life, Teddy showed us all what it means to be a leader in our community. We lost a remarkable human being in 2017, but his legacy lives on through the many organizations and causes in which he believed. This lecture is a magnificent way to celebrate and remember our dear, dear friend, Teddy Cutler.
Thank you, Joanna, and to Lee Pelton for his moving tribute to our good friend Teddy. I'm Catherine D'Amato, President and CEO of GBFB. I wanted to thank you all for joining us. Special thanks to Joanna Travis and to our guest today, Dr. Anita McGahan, and lastly to the Cutler family for their support and for joining us this afternoon. As we all know, early last year, COVID-19 caused businesses to shut down, schools to close, and unspeakable suffering, loss, and isolation, resulting in an economic crisis that launched GBFB into disaster response, where we still remain today. And just like Teddy, our heart goes out to those who are struggling for all that we believe in is a right, the right to have access to 3 healthy meals a day. Our speaker today is Dr. Anita McGahan. Dr. McGahan is a world-renowned scholar, a university professor who has done extensive research into what lies ahead in a post-COVID world. She will share her insights on how the systems we rely on are changing because of this pandemic, and more importantly, how they have already changed our lives. Dr. McGahan, thank you for joining us today.
Thank you very much, Catherine. Thanks to the Cutler family, to the events team, and to everyone at Greater Boston Food Bank. It's remarkable that just over a year ago, we were adjusting to the news of the pandemic and trying to figure out how to address its consequences. It feels like such a long time ago. Everything has changed so profoundly. And that's especially true for the neighbors that are served by Greater Boston Food Bank. What I'd like to do over the next few minutes is just provide a brief overview of what has happened and where we are now, and then spend a few minutes talking about what our research is showing may happen over the next 5 years, and then spend the bulk of the time at the end talking with Catherine about your questions and about the future of the food bank. So before COVID, 1 in 11 children in Massachusetts were food insecure. I have a chart here to share with you, just to show you how the pattern has developed over time. So 1 in 11 children were food insecure in 2019. That doubled in 2020, roughly doubled to 1 in 6 children. So a remarkable increase that actually made Massachusetts the most challenged state in the country with regard to the increase in food insecurity. We've had a recovery to 1 in 9. So 1 in 9 children now in Massachusetts are food insecure. But as you can see, it's only a partial recovery. We're now the 5th most challenged state in the country compared to prior to the pandemic in terms of food insecurity. So, it leaves us with great concern and a lot of work to do to serve our neighbors. The pattern of unemployment has followed a kind of similar path. So Massachusetts back in 2019 had one of the lowest unemployment rates in the country at 2.9%. That increased to 16.4% in April of 2020, a number that hasn't been so high since the Great Depression. And Massachusetts had higher unemployment in April 2020 than the rest of the country, which of course had a similar increase, but not to the extent that we had here. We've had a partial recovery. We're now at 7.1% in February of 2021. That's a partial recovery. We're still worse than the rest of the nation. That's, of course, remarkably lower than the peak, but it's still shockingly high compared to before the pandemic. What happened in Massachusetts was that our economy was so fine-tuned to the systems that were in place before the pandemic that they broke down very fast, and many people became food insecure who never thought it could happen to them. The response at GBFB has been quite remarkable. In fact, incredible over the last year and a half. Leadership, innovation, compassion, and action. Catherine and Joanna mentioned a few statistics. Let me just emphasize exactly how they added up to create this enormous operational and logistical challenge that the food bank overcame. So the team has estimated that the number of people receiving help from a food pantry in Eastern Massachusetts is now roughly twice as high as it was just prior to the pandemic. The number of pounds of food that were distributed in 2020 were about 50% higher than in 2019 in the comparable period. Direct distribution of food by partners, the 600 partners that GBFB works with in the local communities of Eastern Massachusetts, direct distribution by the food bank itself was up 100%, and there was a 130% increase in spending on food that was distributed through those 600 partners. So more than a doubling of the amount of activity. And many of the clients that came in were new, 40%. So new clients are especially time intensive in terms of volunteerism because they often require support in signing up for supplemental food assistance through the SNAP program and so on. So with more new clients, you need more volunteers. But of course, during the pandemic, volunteerism dropped dramatically as our volunteers followed government guidelines to stay home and to avoid contact with others. So we have this vast increase in demand. We have it completely unprecedented. There was no foreshadowing of this. There was no sign that the pandemic was on the horizon. We have roughly a doubling of operational activities. We have a lot of complexity in the 600 partners. We're all facing the same challenges as the Greater Boston Food Bank did in direct distribution, in terms of having shut down volunteerism and do more with fewer people. Some of them had to close and diverted demand elsewhere in the system. So this unbelievable complexity and increase in demand occurs at the same time as a strong increase in donated food from non-traditional suppliers. A lot of problems in the community of the 600 partners, and a dramatic drop in people power at the food bank all at the same time. So just a remarkable operational and logistical challenge, financial challenge during this period. So the Greater Boston Food Bank stepped up, and that was accomplished through management practices that really reflect frontier thinking by business scholars, such as setting up a COVID-19 response team, which occurred at the food bank all the way back in February of 2020, prioritizing interventions, experimenting, troubleshooting, fixing, learning. The resilience, the incredible accomplishments of the food bank in leadership, analysis, resilience, agility, partnering effectively in operations, financing. I want my students to study what happened here. What guided all this change were the principles that Mr. Pelton described, what Mr. Cutler stood for. I didn't know him personally, unfortunately, but I've discovered that you can't spend a spot of time at Greater Boston Food Bank without hearing the kinds of things that Mr. Cutler would say. Give every child a chance, give everyone a chance at a healthy, productive life. GBFB's mission is social justice in the city. Cultivate hope. Think of hunger as a healthcare challenge, and lock people in a room if that's what it takes to get conversations going and to make things happen. The team here at GBFB has lived these principles in the face of the unimaginable to keep this city whole and healthy and hopeful and as well-fed as humanly possible. It's an incredible achievement that will go down in the history books. Congratulations and thank you to the team. So where are we now in food insecurity here? As you know, Boston initially suffered a very heavy caseload of COVID back in April of 2020, not as much as New York City, but much higher than just about everywhere else in the country. And that was subsequently managed down significantly, especially the death rate here. So what I'm showing here is a New York Times analysis that shows that deaths per 100,000 residents in New York were highest in the nation. Boston appears to be in second place here. So we have a very high level of impact of COVID in Boston compared to our peer cities. We are more like Detroit than we are like Seattle in terms of our death rate and the amount of impact, direct impact of the pandemic on the lives of Bostonians and of Eastern Massachusettsans. So Eastern Massachusetts has, there are a couple of reasons for this. Eastern Massachusetts has more high-touch service interaction than most other cities of about our size. That's because our top industries in the area are healthcare, scientific exploration, hotels and accommodation, food services, education, administrative services like accounting services, waste services, retail, transportation, and warehousing. And in these industries, you simply can't work from home. You have to show up and deliver these services person to person. And that density, that intensity of service industries in the Boston area is one reason why our death rate is relatively high. The second big piece of this is in housing. So our housing stock is relatively old, and 19% of the city's residents live in an affordable housing where it is very hard to isolate. It's hard to learn from home. Overcrowding is an issue. It's hard to remain at social distance in a lot of affordable housing because of the way that it's organized. So compared to Seattle, the structure of Boston's economy and housing stock mean that low-income people can't escape exposure to each other and exposure to the virus as readily. So the virus has hit us harder than other cities as a result. It also has hit us unequally. The city of Boston estimates that COVID cases and deaths are disproportionately high among residents who identify as Black, Latinx, Asian, and Pacific Islander. Black Bostonians account for 25% of residents, but 33% of deaths. So COVID has hit communities of color in the city the hardest. Still, there's reason for optimism. As you know, vaccine distribution is going well after a somewhat bumpy start. Vaccination rates in Massachusetts are higher than the national average and are increasing at a pace that gives us a chance of beating the variants before they become entrenched. That there's a sense that a kind of ending may be in sight, hopefully for some time this summer. And it sure will be a joy to be together at 70 South Bay next year to honor Mr. Cutler. I'm hoping for that. So even if that happens, we will be dealing with the impact of the pandemic next year. And in fact, I think over at least the next 5 years. So let me turn now to the future. I want to pick up on 3 themes, which are the volatility of food insecurity, the complexity that will result from COVID over the next 5 years, and then the consequences of food insecurity for the city itself. In making these remarks, just about the only thing that I'm 100% sure about, by the way, for the next 5 years is that any specific prediction that I'll make won't be exactly right. Just like the disease itself, some of the challenges that will emerge in our future will wend around our systems in ways that are hard to see now, but will turn out to be important. So we don't know exactly what will happen, but still the research is showing some imminent challenges. So I'd like to highlight the 3 that I've just mentioned. The first is volatility. So to set the stage here, I wanted to show you this chart, which represents more or less what's happened over time to average levels of food insecurity in Eastern Massachusetts. We've gone from a 2019 level at the left-hand side here that's relatively stabilized to a very high level followed by a partial recovery. Feeding America has just issued a report projecting that the recovery here in 2021 is likely to be slow, with about 1 in 9 children as food insecure, as I previously mentioned. But the numbers on the levels of food insecurity don't tell the whole story. The research and analysis that we've been working on suggests that the trend line is going to be accompanied by greater volatility that come from 3 main sources. The first reflects the fact that we're moving from a framework of general population disease management toward a framework of targeted case management. So that means an opening up of restaurants and businesses and schools and educational institutions. And where we do have hotspots of COVID, where we have evidence of COVID, we have to go in and do aggressive and targeted case management to shut down an elementary school class or a workplace in order to make sure that COVID doesn't spread, and then make sure that the people who have been exposed are isolated and quarantining. So we know that COVID is going to crop up and have to be addressed aggressively to keep it contained. This is going to hit low-income workers hardest, this aggressive and targeted case management. The reason for that is that the best opportunities for low-income workers often require contact with the public and service industries, and the reopening of the economy is going to create greater risks for these workers. So you have more underlying vulnerability, more risk of exposure for low-income people. That means these tough interventions where you have to shut people inside quarantined areas are going to hit those on the financial edge hardest here. So not everyone will be affected equally. Poor and vulnerable people who are just pulling out from the economic hardship of the pandemic will become vulnerable to quarantine and to loss of work and loss of housing as a result, even while the rest of us are going back to work and school. So we have this intensified inequality. The longer that someone in a situation like this has been out of work and stretched to the limit, the harder it's going to be to recover from even a temporary quarantine. So the waves of food insecurity that arise from this are likely to be amplified by the accumulating pressures on low-income people through the pandemic. The second source of amplified volatility is going to come from government policies that may arise in the general population. We may see episodic shutdowns in response to threshold levels of disease again, such as a partial closing of a school becomes the full closing of a school. And that's going to hit low income communities the hardest as well. It'll amplify the food insecurity caused directly by the disease. And those closings will occur in waves. And that means that the food insecurity associated with the closings will occur in waves. The third source of the amplified volatility associated with these targeted closings and the reappearance of illness and the loss of financial cushions and so on relates to trends that were in place for up to a decade, even before the pandemic. And I'm thinking in particular of shortages and unaffordable childcare. So the shortages of childcare make it even more difficult to avoid quarantine if you have a child who has been exposed, and more work on contract rather than on salary, which means no benefits or security and no guarantee of return to work if you are quarantined for 2 weeks after exposure. So yes, the need may be projected to be lower, 1 in 9 children, may be lower on average in 2021 than initially forecast, but these episodic crises mean that we'll have to ramp up fast. We need to be prepared for these bursts of food insecurity here. And that's going to require developing new types of organizational practices and capabilities. We need to economize in periods when food insecurity is relatively low, but be prepared for volatility if it arises. Let me turn that off now and just briefly focus on my final 2 predictions about the future. The second point I want to make after volatility is that COVID is creating greater complexity in the needs of those who come to us for food. The Greater Boston Food Bank has been a pioneer in integrating healthcare into its approaches. Many of those who are food insecure dealt with a range of health challenges that were daunting even before the pandemic. COVID lays on an additional challenge, a set of challenges that are mind-boggling. The trauma of loss is almost unbearable, and it's concentrated among persons of color in the city, persons who are low income. Those who suffer most have been traumatized by loss. An estimated 1 in 500 residents of Boston have died. About 1 in 9 reportedly have had COVID, although we believe that more than twice as many people may have had the disease at some point, a lot of undiagnosed COVID. Of those that have had COVID, roughly 10% are long haulers with intense fatigue, insomnia, and confusion that makes it hard or impossible to function, certainly makes it impossible to work. So, COVID has hit the food insecure hardest. The healthcare challenges emerging here also include very significant mental health disorders resulting from trauma that comes from other places as well, not just loss of loved ones, but also loss of jobs, depletion of savings. We know that many people with diabetes and heart disease have deferred routine healthcare out of fear of exposure at the hospital. That problem alone is expected to lead to excess deaths over the next 5 years. And the continuing stress of trying to be isolated and socially distanced, especially if you're in a complex housing situation, that has been compounded by the experience of the isolation itself. So all of this is interwoven with the opioid crisis that has hit Boston hard. So we get fear instead of hope in many of the decisions of the food insecure. We have many food insecure people who are not appearing at our doors in the way that they used to. So I can just imagine what Mr. Cutler's reaction would be. He would say, we need to cultivate hope where there is fear. That'll require new types of organizational relationships and new kinds of coordination, deeper, stronger, flexible partnerships across sectors, including emergency health services, emergency childcare services, and of course, law enforcement. So the demands on GBFB are likely to become more intense and complex because the impact of COVID is becoming more complex and intense. We're going to need to rout out food insecurity in ways that are unprecedented. It's going to be harder to address. The last of the 3 points I wanted to make about the impact of COVID over the next 5 years is the consequences for the city. Food insecurity profoundly affects the way that the city feels and the way that it is experienced by residents of Boston and Eastern Massachusetts more generally. So the pandemic has driven out many residents with the ability to leave town. We don't yet have a precise understanding of what has exactly happened, but we are seeing that across the country, young people, especially millennials that are now in their 30s, who moved to the city for vibrant arts and restaurants and cultural life, they're now buying houses and taking their wealth into the suburbs and rural areas in unprecedented numbers. So real estate values in the city core are still incredibly high, but the costs of homes in rural places are escalating to the point of these bidding wars, and you get these city escapees who are planning to work for home on a permanent basis for at least part of the time, taking their wealth out of the city. And 30-year-olds or people in their in the millennial group are especially important to the vibrancy of the city. So this means the nature of the economy is shifting. Companies are leaving. We're now seeing companies making arrangements both to support at least partial remote working schedules and also to lease lower cost office space. Financial districts have been empty even at midday in recent months in many major cities, including New York. So there are other effects also. Just to point to one more set, the challenge to retail that was already affecting places such as Nubian Square and Roslindale's Washington Street has been accelerated dramatically during the pandemic, as many people have turned to bulk buying and to online ordering of even basic staples. And a lot of that change in behavior is likely to stick. Same thing in university education. Online delivery of classes is likely to stick in part, and that's going to affect job opportunities, especially for low-income people that worked on college campuses in various roles. We will see some new opportunities, especially in last mile delivery, driving delivery trucks, and healthcare, but closings in traditional retail and office work and university support and all of the related businesses that depended on an active downtown core. So that means some challenges of food insecurity. We know that job churn alone can create food insecurity. If someone moves from one job to another, there can be a gap, there can be a transition that's costly and can leave someone vulnerable to food insecurity. Of course, less economic activity means lower tax revenue to the city, and revitalizing Boston and Eastern Massachusetts will require re-envisioning the community at its foundations. Questions will come up regarding how empty space in the downtown core can be repurposed. Demand for job retraining will arise, and leaders both in government and in the private sector will have to make tough choices on how to spend scarcer and scarcer dollars. A fundamental challenge will be to reconstitute the city's vibrancy and innovativeness, even despite the fact that hotspots of illness are likely to be with us until the disease is controlled in every place on the globe, which could take at least 5 years. We know that a single case in Wuhan, had this incredible impact on the global economy. Until we rout out every variant in every place on the globe, we all remain vulnerable. And as we do that, the question that is on the table is, how do we reopen Eastern Massachusetts and Boston specifically as a vibrant place that attracts innovators and creators and young people and advances scientific knowledge? How are we going to do that? That'll be a conversation that we have to have over the next 5 years. Mr. Cutler himself had answers. I can just imagine what he would say: bring humanity to the place at every opportunity, compassion, the arts, social justice. All that begins with food security. As he said, food security is social justice, and social justice is what will create that foundation that gives Boston strength and vibrancy. We have to fight desperation. We must fight to keep the city economically and socially vibrant and keep it a humane place. Fighting food insecurity is fighting for our community. This is the place from which we reopen and rebuild. So let me sum up by saying that as we turn to the enduring impact of this pandemic on food insecurity, that Mr. Cutler stands as an example to us in so many ways. His commitment to the arts, of course, brought humanity and compassion to the city. He was a business executive who made great decisions in tough as well as less tough times. And he was prescient. Thank goodness that he and Catherine envisioned and supported and led the campaign to construct the facilities at 70 South Bay Avenue when they did. His identification of food security with social justice is just so compelling. It's impossible to turn away from. And the idea that GBFB gives children a chance by transforming fear into hope and hope into opportunity, that's what the Greater Boston Food Bank has been doing throughout the pandemic and doing such an incredible job. The food bank has stood up to the example that Mr. Cutler said. The only suggestion that I'd offer is that there's just one of Mr. Cutler's principles that we can't follow just yet, which is that we lock people in a room until they start talking to each other. We're not quite there yet. Thank you very much.
Thanks, Anita. Your remarks are incredibly insightful, and hearing you speak is always thought-provoking in terms of the application of our work around food security. You've given us so much to think about. Now we're going to transition into the Q&A portion of the program, and I'm hoping we can dig a little deeper into these concepts that you've given us. For our audience members, the chat feature is open. Please post your comments and questions. If you are unable to access the chat, please send your questions to events@gbfb.org, and a staff member will follow up with you as soon as possible. So Anita, so good to hear your concepts and to have you put this in the three very important points that you've made, the first being volatility. So you've mentioned that there's going to be this greater volatility in food insecurity over the next 5 years as a result of COVID. So in your view, what is the trajectory of that volatility? Is there an end in sight? Is there something in particular we can expect to see in Boston?
You know, it's in the nature of volatility that it's unpredictable. What we can anticipate, though, is that there will be periods of intense food insecurity, maybe even more insecurity than has occurred in the last year or so, followed by drops. And what we need to do is build the organizational capabilities, the resources. For example, the volunteer corps, a volunteer corps that's ready to step up if needed in a period of recurring emergency. And then a volunteer corps that's also trained to step back once that volatility ends. So same would be true of working with suppliers, trying to think about how can we develop relationships and partnerships where we plan in advance to be able to step up if major challenges occur. And then, of course, working with the 600 partners that network of partners through which food is distributed across Eastern Massachusetts, making sure that they also are prepared for the volatility that you're describing.
Well, the volatility you're speaking of is something we've been experiencing, right? This inability to fully understand this uncertainty and to try to be prepared. And clearly, one of my questions is for you is how do you see this impacting our operations? And, which is the most certain thing is the uncertainty, but also funding, right? The people are beginning to say, have COVID fatigue or move on maybe to another charity.
I hope that your funders who take that position rethink that position.
Yeah.
Because food insecurity is the place you must begin to support someone in unlocking the whole portfolio, the whole range of challenges that they may face. So right around the corner from GBFB, we have this Boston Medical Center area that has been struggling with the opioid epidemic and the consequences of that for homelessness. And, the problems and the challenges in that part of the city are extremely complicated and multifaceted. How do you even begin to start to address those challenges, which are likely to be amplified and intensified as a result of the impact of COVID? Not just the direct impact of the virus itself, these long haulers not able to work, for example, but also the indirect, or I don't even want to say indirect, the amplifying effects of COVID from mental health crises, loss of financial security, loss of jobs, loss of housing. How do you even begin to address that range of challenges? For example, in that part of the city or any part of Eastern Massachusetts, the place to begin is by cultivating food security. Everyone understands food and understands that they're being cared for by their neighbors when their food insecurity is being addressed. So connecting with the most vulnerable people in our state through the food bank is the place that we begin to actually rebuild and reconstitute our city and our communities.
Well, on that issue, let's go to complexity. You talked about how complex food insecurity is, and you just outlined that in your comments about volatility. So to date, we've focused intently on addressing hunger to provide as much food as possible, as much healthy food. Yet we know that many of the people we serve have very complicated lives, requiring very complicated solutions. And GBFB is one of many organizations addressing food insecurity as a result of poverty, racial injustice, education access, housing, etc. What thoughts or advice do you have for systematic change, to be able to impact the social determinants of health that lead directly to hunger?
Now, Catherine, I wonder if I can actually ask you for your thoughts on that question as well, because I know that this is your daily activity. This is what you do. I mean, from an outsider's perspective, as a business school professor and as someone who has been specializing in health security in her research program, I would say things like strengthening partnerships, making sure that we know that we have a plan to activate partners, say, in the health system or in emergency services or in housing or in law enforcement or in childcare, when we are presented with cases where that complexity is evident and where action is obviously imperative. We need to know what we're going to do. We need to have planned for what we're going to do. And then building capabilities in that network of 600 partners. So how do you get kitchens and, remote people in remote rural communities, the kinds of services, or the capacity to deliver the kinds of services that may be more readily accessible in the city. So building and strengthening these partnerships so that we can work together more effectively and more quickly to meet the needs of the neighbors that you serve. But is that aligned with your experience?
It absolutely is. I mean, we are very focused on some, pillars that are so important to our ability to do our work, right? So the increase of healthy food and making sure that that is consistent and that the access is sustained, ensuring that the network of these 600 organizations across Eastern Massachusetts have the appropriate capacity. And we have found ourselves doing a lot more, giving resources to them, financial resources to them to help shore up. We were very fortunate that in COVID, only 5% of our agencies closed. That was not true in other parts of the country, which spoke really well to that strength of the network and how it is knitted and dependent on each other. And we've got to keep people safe, Anita, that these complexities of health and housing and racial injustice and going on, that it isn't just here's some food and see you later anymore, that our work is really being challenged to develop emerging models, new ways of making sure we reach that hungry person. So let's look to your third point, which is consequence, right? What do you feel are the highest priorities for us to address? As we've been talking about, it's complex, it's volatile, it's uncertain. It requires innovation. It requires changing a whole system. If you had to name one thing in all of your work, the world that you see, both here in Boston, in Eastern Mass, our country, and the globe, what would that be? What might be that one thing that you would say we should do right away? And what do you see in our future that will never diminish?
It's hard to pick one thing.
Okay, I agree. I agree.
The reason that it's hard to pick one thing, I think, is because, COVID has exposed unfairnesses that have made a lot of people very angry, and unfairnesses that are intolerable for all of us. Black Lives Matter, You know, we have to figure out a way to make progress on these core inequities that lock people into poverty, you know, discrimination and racism. We have to make structural changes that are going to make people less vulnerable to food insecurity at the very foundations. So that's that humanity, you know, that reconstitution of trust and of compassion and of kind of shared experience in the city where, you know, you're not afraid of walking too close to somebody on the street because that person could be dangerous for you. That fear has to somehow get melted away. We have to find a way to reconstitute hope and to reconnect, and that involves a multi-sector approach. Now, what's a high leverage point? What's a high leverage point in the system? I think we're going to have to find food insecure people more aggressively and intensively by reaching through some of the partners that you're already working with in housing, in education, in childcare, in law enforcement, to find people who are vulnerable and to reach into them where they are and serve them and provide them with support. They're not going to show up with an open trunk in a parking lot as readily as in the past. So figuring out a way to reach out and connect to the food insecure, new ways to reach out and connect to the food insecure, perhaps through digital tools or better system integration with other major agencies in the city. I think that would be a place to begin. Well, do you agree? What do you think?
I would agree. I mean, I think the emerging model is in front of us, you know, to reinvent the way we think about who is food insecure and how to get the food to them. And I do believe that the tools in the toolbox are going to be different. And more importantly, it has to be collaborative. You know, it isn't just an alone service to a one-on-one. It is much more about a community and understanding, as you noted, what are the complexities of that community, and therefore, how do we try to address them one at a time? You know, put one foot in front of the other to be able to make sure. But most importantly for us, it's ensuring that continuity of food, that there's good, healthy food available in a number of locations for folks, especially if they don't have a car. They can't drive through a drive-through or a curbside. It has to be brought to them. So more on that for us to think about. So as our nation experienced vast inconsistencies throughout this crisis in political leadership, you and I have talked about this, you know, how do you see volatility in leadership, complexity in policy solutions, and of course the consequences they may have playing out, you know, around food insecurity? This is a moment. This is a point in time with our current administration and the awareness around food insecurity, but the way we lead here is going to be important.
Oh, I couldn't agree more. You know, I can't help but to remember maybe a year ago, you and I talking about how utterly frustrated and concerned we were about the position of the federal government on food security. And, you know, here we are now, 1 year later, in almost exactly the opposite situation in terms of at least awareness and consideration of food security as part of a potential new infrastructure bill. I think the bottom line, though, is, and I think the way you framed this question actually was you know, characteristically smart about what's happening. We can't know what's going to happen in 2022 in the midterm elections. We can't know what's going to happen in 2024. What we can know is that, you know, that we have a very divided country, that we have a lot of frustration on many different sides of large divides about what's important. So what does this mean for us in Eastern Massachusetts? We need to build a fortress of private sector engagement and support for crucial services such as food security services in our city and in our state that can function as a buffer and as a first line of defense against the kind of volatility in national systems that you've described. Right. We have to, as a community, step up and bring our best resources to knitting together a system of services that support the most vulnerable in our communities. I mean, there's one thing that we've all learned out of COVID. It's that the vulnerabilities of a single person anywhere on the planet can destroy entire economies. So we can't, it would be a vast mistake to underestimate the importance of the city's opportunity to knit together and support the kind of activity that you've been leading at the Greater Boston Food Bank this year.
I mean, I would agree. This is a partnership, a public-private partnership, but the awareness around the important to ask the question whether you are a corporation of workers. Do your workers have enough food? That's all about productivity, about being able to stabilize and work and stay in a home and be part of a community. There's so many factors there. So, the news is talking a lot about the variants and how do we address these, and it's on people's minds. So how are the continuing, prevailing, and pervasive variants, that the vaccines are going to be a factor in our recovery, particularly vulnerable populations?
Right. So, we're still learning about the variants. So I should confess, my background, my PhD is in economics, and my specialty is in organizational strategy and theory. And although I am cross-appointed to the medical school and to the School of Public Health at the University of Toronto, my expertise tends toward public policy and business policy. So that's where I'm coming from in answering this particular question. I think one way to think about the problems that will arise until COVID is completely controlled is that we're moving from a period of thinking of COVID primarily as a general population health threat that needs to be controlled by shutting down everything, shutting down workplaces, shutting down schools, to now we're moving to a period of targeted case management. And we can think of that almost as an information problem. We have to find COVID where it breaks out quickly, and then we need to intervene fast to make sure it doesn't spread any more than necessary. In other words, we have to control through quarantine and through the administration of medicines infection in hotspots where it arises. All of that is contingent on the variants being controllable. If any of these variants start to defy the vaccines or start to spread in ways that the vaccines don't provide protection against, then we're back to square one, and we have to go back to general population COVID control or disease control. So it's going to be, we are in a race between the variants and the vaccines and trying to control this disease, and it's going to, that challenge is going to contribute to the volatility and the complexity and the consequences that we've been talking about.
Yeah, and I mean, that's your point about complexity and how does the complexity around business reopenings compound the uncertainty for those vulnerable populations. We're seeing it, and they are hardest hit, and it is a challenging point to make food and food insecurity a very important part. But historically, Boston's had a depth of interaction with social justice, and that has led to our compassion around addressing issues most paramount to our society. And philosophically, do you see the city of Boston uniquely positioned? I mean, we're having an enormous talk about change in leadership, first woman, first person of color. And here we are. How are we positioned to manage as a city that volatility, complexity, and consequences of food insecurity?
Well, we've already talked about, the support that the Greater Boston Food Bank has earned and deserves, and should have as we move forward from everyone in the city. everyone bringing their best capabilities to the challenge of food insecurity and into supporting the food bank. I can't help but just reiterate what an impressive job you and your team have done, Catherine, in stepping up to the challenge, in making this happen. Fewer volunteers, fewer people, twice as much need. It's really quite remarkable and very impressive, and an effort that needs to be redoubled and and supported. It's as if you've hit one grand slam home run, and now we need to prepare to have to hit future grand slam home runs, and we need, as a city, to choose to do that with compassion and humanity and a kind of commitment to the most vulnerable people in the city. I'm very fortunate. I've lived most of my life in Massachusetts. I came here as a student and didn't leave. And I feel that, Boston in Massachusetts has a unique commitment to social justice. This is a bastion of conversation about what social justice is and what social justice means. And that, for me, Mr. Cutler has told us, that the linchpin to the instantiation of social justice, to recreate the kind of community that we all want, is by making sure that there isn't this incredible challenge of hunger in the most vulnerable people in our communities. And to me, this is our community. This is what we have to do. We have to rebuild food, from food security through to recreate the kind of fabric of interaction between very diverse people across the communities that GBFB serves, so that we can stay knit together and tackle this thing as a community.
Well, I agree. I think the knitting together is so important, and how we are able to stand as being one of the most basic issues, that we need to make sure people have enough food. And from there, things tumble: housing, education, opportunity. It's all there, Anita. And I want to thank you for your presentation and for the conversation today. Your research is inspiring, and it's so important for us to understand how this all connects in this new world, now that we are in COVID, living with it, and then have to go through it. The fact that you're saying that for 5 years we're going to be experiencing these factors that you've outlined for us are quite tremendous. But most importantly, and my thanks to you as my friend and someone I know, thank you for sharing your genius and your research and how you view the world. It's very helpful to us, because we're going to need everything that we can get our hands on, and everyone, to help us be able to truly make food insecurity go away, and to begin to turn to be about food security, and to ensure that people have that in their lives. So thank you. To that end, you're welcome. To that end, next month on May 6th, we'll be kicking off our GBFB Focus Series, where we will facilitate conversations on issues impacting GBFB and our constituents. The CEO from Feeding America, Claire Bobinot-Fontenot, will be our featured speaker in conversation hosted by NBC correspondent Cynthia McFadden, both also good friends of the food bank. We will hope that you will jump in and join us with that as well. Thank you for joining us today, and please stay safe and remain healthy.